your patient portal, tap the PDF that says lab results, and your stomach does that tiny flip. Numbers, abbreviations, narrow reference ranges, instantly overwhelming. I see that reaction a lot, and I want to make this simpler for you.
My central idea is simple. Numbers never hang out alone. Context gives them meaning. Today, I'll show 3 habits that stop panic and start useful action. Keep those 3 habits in your head, and everything else will slot into place.
A patient once texted me at midnight, "My hemoglobin is low. Do I need to go to the ER?" That panic is why this episode exists. We'll cover what usually matters fast and what you can safely handle by asking the right questions. First, quick lab basics that save a lot of confusion. Labs are snapshots, one blood draw at one moment. Reference ranges are population averages, not a moral judgment about your health. You might see a number just outside the range and think, oh no, but normal shifts with age, sex, pregnancy, even altitude. So before you panic, gather 3 quick facts. Was this fasting? Any meds or supplements? Were you dehydrated or ill that day? Quick checklist to say aloud when you message your clinician. 1. Were you fasting? 2. Any meds or supplements to note? 3. Want me to compare to prior results? Those 3 questions flip the story a surprising amount of the time. Let's start with the CBC, complete blood count. Think oxygen delivery, infection surveillance, and clotting capacity in one panel. Hemoglobin and hematocrit tell us about your blood's ability to carry oxygen. Low values suggest anemia. Common causes include iron deficiency, chronic disease, or blood loss. A drop over time matters. If your hemoglobin was 13 6 months ago and is 10 now, that trend is worth investigating. White blood cells rise with infection or inflammation and fall with some medications or bone marrow issues. Platelets help clot. Very low platelets increase bleeding risk. Very high can reflect inflammation. Small shifts often mean watchful waiting. Now, the metabolic panel and electrolytes, this is where we watch hydration, kidney function, and salt balance. Ever opened a lab and seen potassium high and your stomach dropped? Potassium controls nerves and muscle. When it's markedly high or low, it can affect the heart. Those are numbers we don't ignore and often act on quickly. Creatinine and BUN give a sense of kidney function. A sudden creatinine rise or much less urine than normal is a red flag. Call your clinician. Liver enzymes, ALT, AST, alkaline phosphatase, signal liver stress. Mild bumps often follow medicines or fatty liver, but very high values with jaundice or dark urine deserve prompt attention. A key point, common medicines like ibuprofen or naproxen, over-the-counter NSAIDs, ACE inhibitors, and some antibiotics can change labs. Herbal supplements matter too, so when you talk to your provider, list everything you're taking. Moving to longer-term markers, lipid panels, A1C, and TSH. Lipids estimate cardiovascular risk. Decisions are based on the overall risk picture, not a single number. A1C reflects average blood sugar over about 3 months and is useful for diagnosing and tracking diabetes, but it's affected by conditions that alter red blood cell turnover. TSH screens thyroid function. Mild TSH abnormalities in someone feeling well often lead to repeat testing rather than immediate treatment. For lipids, A1C and TSH, trends over months or years are far more informative than one isolated value. Now, exact scripts you can use. Say this one when you message your clinician. My test name is value. Was this sample fasting, and could any meds or supplements affect it? And this when you want comparison and next steps. Can you compare this to prior results and advise whether repeat testing or referral is needed? A couple of quick examples I see a lot. Mild anemia with heavy periods, start with iron studies before assuming the worst. Slightly elevated creatinine after intense exercise or NSAID use? Check hydration and retest before escalating. A borderline A1C after a short steroid course? Ask whether recent LEDs could explain it. Repeat that 3-item checklist with me. Say it out loud if you need. 1. Were you fasting? 2. Any meds or supplements to note? 3. Want me to compare to prior results? Use it every time you message or call about labs. Before we close, 2 important safety points. If you have chest pain, severe shortness of breath, fainting, major bleeding, sudden severe abdominal pain, or signs of liver failure, like yellowing skin or dark urine, seek emergency care now. Also, if the lab flags a value as critical, or your potassium, creatinine, or white blood cell count is markedly abnormal, contact your clinician or the emergency department promptly. 3 takeaways to keep in your packet. 1. Look for trends, not single values. Ask for prior results. 2. Always confirm pre-test conditions, fasting, meds, dehydration, or recent illness. 3. Use short, focused scripts when you contact your clinician to save time and get clearer guidance. If this episode helped you read a lab PDF with less panic, I've done my job. If you want a future episode on a single test, say A1C or liver panels, I'd love your questions. If this was useful, subscribe so you don't miss the next myth-busting breakdown. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant. You can learn more or schedule a consultation at faqbynursejessconsulting.com. Please share, subscribe, and leave a review. Help this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.